Okay, this is going to be a talk about what causes hypertension. So this is part 2 of what causes hypertension. Part 2 of what causes hypertension. All right, every cell has a potassium, sodium, ATPase pump. I put the word for potassium, K+, kalium like in the Latin, natrium in Latin for sodium. I put the K+ first, the potassium, because it is the K+ being pumped into the cell as we have drawn here, and the sodium being pumped out of the cell drawn here. So I put the thing going into the cell first because it's going to become helpful that way to think of it that way. If you always draw it the same way, you'll always know what you're talking about quickly. All right, so the potassium, sodium, ATPase pump pumps 2 potassium into the cell and 3 sodium out of the cell. This ATP is then split. It splits off a phosphate, and the ATP becomes ADP as part of this pumping mechanism. So it requires energy from ATP. The one thing that very few people know is that magnesium is bound to the ATP. The phosphates, and there's 3 of them, adenosine triphosphate, tri as in 3 phosphates. Those phosphates are highly negatively charged, and they repel each other. So having a positively charged magnesium helps to bridge between the phosphates and enable the ATP to do its job. Otherwise the phosphates would be increased likely to just pull apart from each other. But this is highly important that you have to have magnesium in order for the ATP to be able to function in these reactions. It's seldom even mentioned, and most people aren't aware of it, but magnesium is essential for maintaining proper concentrations of electrolytes in a cell. And every cell in your body has these potassium, sodium, ATPase pumps. They're especially important in what are called excitable cells. Excitable cells are your muscle cells like skeletal muscle, smooth muscle, and cardiac muscle. And they're also very important in your neurons in the brain. Okay, so again, you're pumping out 2 potassium and you're pumping 2 potassium into the cell, pumping 3 sodiums out of the cell, and this will cause a negative resting membrane potential because you're pumping more positive charge out of the cell than you are pumping positive charge into the cell. The typical neuron in the brain we're going to use as our example, negative 65 millivolts for the resting membrane potential, the difference in charge across the plasma membrane. And this makes it like a battery. It's able to store a charge difference. You're able to have a current in a sense when ions flow across that membrane. Okay, so the cell uses this for energy, and the most important way this potassium sodium ATPase pump and establishment of a resting membrane gradient is used is to manage calcium. And by the way, for sodium, there's 2 gradients. There is a charge gradient based on the difference in charge outside the plasma membrane. Here's the plasma membrane of a cell. There's the charge gradient is the difference in charge outside the cell and inside the cytoplasm of the cell. So that's a charge gradient or electrical gradient. There's also a concentration gradient based on the concentration of sodium. And that is across also this plasma membrane of the cell, and that is a chemical gradient for the concentration of sodium. Electrical gradient for the charge difference. And here's a look at the charges. In the blood, sodium is very high, 140. Inside the cytoplasm, it's low, about 14. Potassium is the opposite. It's low in the blood at 4, but very high inside the cell in the cytoplasm at 150. So potassium is the most important intracellular cation, positively charged ion. Chiho. Chiho. Okay, sorry about the dog there. All right, so what happens now is you have to adequately maintain this negative 65 millivolt resting membrane potential in your cell for it to be able to do its other jobs. Because ATP is used for handling the potassium sodium ATPase pump, this is called primary active transport. It's primary because an ATP is being used. Then this is what is called the sodium calcium exchanger to pump calcium out of the cell. And this is Na, this is Ca, so sometimes it's called the NACA exchanger. NACA for Na for Na, Ca for Ca. plus. And this is called secondary active transport because it's using the energy of the gradient of sodium that was produced by using these ATPs. So this is secondary active transport. Now the concentration of calcium outside the cell is very high. It's 10,000 times higher than the concentration of calcium inside the cell. Calcium is super important for the physiology of muscle cells and of neurons. Calcium, you can think of it as like an on-off switch inside a cell. When you bring calcium inside a skeletal muscle cell, that cell will contract. And when I say bring calcium inside a cell, I'm referring to the concentration of calcium in the cytoplasm. Okay, so a cell is very careful that if it does not want to contract or it does not want to fire an action potential, it tries to keep cytoplasm concentration of calcium as low as possible, okay? And that is a very essential point. And it does it with this plasma membrane knockout exchanger, NACA. All right, so now the way this becomes highly relevant is most people from a dietary point of view, they eat too much processed food, junk food, and meat, and they don't eat enough plant foods. And because of that, they're low in potassium. The body always needs to have the same number of ions, positively charged ions, your cations, and negatively charged ions, your anions. And because of that, when the body becomes low in potassium, because of dietary lack of eating potassium, it will increase retention of sodium ions, okay? And then when the sodium ions become high, you start to dissipate these gradients. If you cannot maintain your proper resting membrane potential based on this potassium-sodium pump, what ends up happening is you diminish your gradient of sodium, and then you're less able to run the NACA exchanger, and calcium starts to accumulate in cells. The accumulation of calcium within cells is a disaster, okay? And this is super common, and this is actually some great physiology. What I'm saying here to you might sound simple, but trust me, this is profoundly important. And lots of persons do not know this because it is really sort of hidden in the scientific literature. But when you start to explore this subject, you will realize a lot of patients with hypertension would tremendously benefit from eating more plant foods so they would have adequate intake of potassium. In addition, it is from plant foods where you get primarily your magnesium. Magnesium is right in the center of every chlorophyll molecule. So what am I saying? What I am saying is a tremendous contribution to hypertension is caused by a dietary lack of potassium and magnesium. Potassium and magnesium are both vasodilators. The reason is when you get accumulation of calcium inside your smooth muscle cells, they are located along the arteries. They line the arteries of your body. When calcium accumulates in those cells, it causes the smooth muscle cells of your arteries to contract. When they contract, they constrict and narrow their diameter. That narrowing of diameter causes increased vascular tone. It's the difference between pumping your blood through a big pipe or a small pipe. When the heart has to pump the blood through smaller pipes because they're vasoconstricted due to high cytoplasm calcium, blood pressure has to go up. The high amount of contraction within the arteries, the smooth muscle cells of the arteries, is called vasomotor tone. Okay, so what I'm giving you here is the great secret of hypertension. This is the main thing that causes hypertension. Hypertension is multifactorial. There are other things that cause hypertension. We're going to briefly talk about some of those, and we also talked about many of those in the last lecture, our part 1 of hypertension lecture. But what I'm getting at here and why this is such a wonderful thing to know is if you're aware of this, you can, and you have hypertension, for example, start eating more plant foods, get your vasodilators, your magnesium and your sodium, and there's a great chance your blood pressure will improve. One has to be careful though. If a person is on medications for high blood pressure and they make this big dietary change where they reduce their intake of meat and processed food and junk food and sodium, and they start eating these plant foods with high potassium and magnesium, they might at that point be over-treating themselves with medication for their high blood pressure, and they could drop their pressure too low, and that could be dangerous. They could have a stroke. So anybody who wants to make a big diet change and who is currently taking medicines for high blood pressure or for diabetes, you need to let your doctor, your healthcare provider know, and you have to gradually titrate this process and work out all your medication dosages with them very carefully. Don't do this on your own. If you're taking any pills whatsoever for diabetes, prediabetes, or high blood pressure, changing your diet is a big deal, and you have to let your doctor know and work with you all through the process. But what I'm helping you understand is populations who eat this way, tons of plant foods, and therefore getting lots of potassium and lots of magnesium in their diet, it's uncommon for them to have high blood pressure, okay? And again, what is the key mechanism? Every cell has to have a resting membrane potential, and it is established by this potassium sodium ATPase pump. And there's additional ion pumps and ion channels in the membrane, but this is the most common one. As a matter of fact, in a neuron, 60% of the ATP energy of the cell sometimes is utilized for this pump. There's tons of them in the plasma membrane, okay? Now there's more to calcium metabolism than just the NACA exchanger. There's also a pump called the SERCA, the sarcoplasmic endoplasmic reticulum calcium ATPase, that pumps extra cytoplasm calcium into the sarcoplasmic reticulum, as it's called in a muscle cell, okay? But in other cells it's just called endoplasmic reticulum. And the reason I mention that is there's a whole bunch of chemicals, including some preservatives in junk food and multiple other chemicals, we'll save that for another lecture, that impair the ability to clear calcium out of the cytoplasm of neurons and or of smooth muscle cells. And all of these things will cause excessive activity in those cells. So anything that increases cytoplasmic calcification in your smooth muscle cells is going to increase your risk of hypertension. Hypertension is the most important disease. The reason why I say hypertension is the most important disease is because hypertension is the #1 risk factor for atherosclerosis. Atherosclerosis in the arteries of the heart is the #1 cause of death. So hypertension is the path to death. And that's the reason why I talk to a lot of people, and in my opinion, they're cognitively impaired. Oh, I just have a little hypertension, it's no big deal. No, it's a big deal, okay? So if you have hypertension, my advice, work this out with your healthcare provider, your doctor, start improving your diet and try to optimize things as much as you can, because you don't want this progressively worsening atherosclerosis to cause more problems for you. What are some other things that come into play? Psychological stress, caffeine, lack of sleep, they all elevate the same hormones, cortisol and the catecholamines. They will cause loss of magnesium in the urine. Excessive physical exercise will also lose some magnesium in the urine, so you have to replace that magnesium by eating plant foods. Insulin resistance due to a high-fat diet will cause retention of sodium from the kidney, leading to high blood pressure. Ingesting industrial fructose, like in sweetened beverages, high fructose corn syrup, will also lead to increased sodium retention in the kidney. It also causes increased sodium retention in the gut. Anything that increases your sodium is going to decrease your potassium. That's also why eating excessive amounts of dietary sodium is so bad for your blood pressure. Sodium is a vasoconstrictor. In addition, as we just spoke about, it'll tend to displace the bodily potassium, leading to lower potassium. Our ancestors, thousands of years ago, ate a very high amount of potassium and a low amount of sodium. Now we flip that around to eating high sodium, low potassium, and the problem is our kidney is made to excrete the potassium, and it's made to conserve the sodium, which used to be more rare in our ancestral path. So what we're basically doing, we're sort of double screwed in that sense, that we're eating way too much of the sodium vasoconstrictor that causes high blood pressure, and our kidney's not as good at handling it as we would hope for, because it's not designed to do that. But what I'm trying to say, what is the big message here, and why do I think this is such a profound, wonderful thing, is that if you understand this point, and it's a big point, I see people dying every day because they don't understand this. Every day, disasters, one after another. Myocardial infarction, stroke, death, disability, dementia, all day long. It's kind of almost sad and depressing being a doctor. Patients are so sick and they just crash and burn. And there's sort of this wonderful, oh, isn't everything great? here's the reality. The reason why chronic disease is called chronic is because most patients never get better. It's chronic because they never get better. They just progressively deteriorate. And what I'm saying is, if a person realizes this, they've at least got a chance to improve. And I think this is wonderful, fascinating stuff. And I can also assure you, I've read quite a bit about advanced physiology in the brain and the hippocampus, and the same things that improve blood pressure also tend to improve cognitive function. So there's some hope there as well. And it comes down to calcium being the on and off switch in a cell, and getting adequate dietary amounts of potassium and magnesium so that these resting membrane potentials can be maintained. So that's it.